Our brains had a sequence and they've been set up to develop in a certain way. Over the last 30 years, that's changed. What's going to happen if we don't make these changes?
I think we're already seeing what's happening. Our 4-year-olds now are physically behind 4-year-olds used to be 20 years ago.
Is it, primitive reflexes? Is it core strength? Is it nutrition? Is it a combination of both?
Lots of these reflexes are hanging around. And when they hang around for too long, we then get lots of different symptoms and behaviors. And ultimately, it'll end up with autoimmune and digestive problems and postural problems.
We're seeing kids moving a lot less due to being in front of screens. We're living a much more sedentary lifestyle.
We can predict what's going to happen in 10 years' time because you can see it through movement.
Whether it's autism or ADHD, every single one of them have demonstrated retained reflexes.
Have they integrated or switched off all these primitive reflexes? Well, if they haven't, we've got to go back there first.
Each reflex that has been developed is inhibiting the next reflex, so the child can move on to help the next level of learning.
Movement milestones are crucial, and our children are now not hitting those movement milestones.
Welcome to Brains Under Attack pod. This is a pod brought to you by BrainX Movement, and we're looking at how the modern environments affect brain development. There's a reason why developmental disorders are on the rise, neurological conditions are on the rise, mental health conditions are on the rise, and this is all down to the threats our modern environment poses on brain development. I've got neurological expert Seb Kane, neuroscience expert Seb Kane on the call, part of the team behind BrainX Movement. We've got Steve Peters on the podcast, and we're here to discuss all of the reasons behind brain development and how our modern environments are affecting brain development in negative ways. So Seb, explain to us, what our modern environments are doing now to brain development and how it's derailing us and taking us off our optimal paths.
I think the foundations are crucial, Steve. The modern environments have drastically changed. We've got more advanced tech in the world now, keeping us engaged for a lot longer. Parents included, but kids equally, because that's the foundational stages of development. And we're seeing kids moving a lot less due to being in front of screens. We're living a much more sedentary lifestyle. And if we understand how important movement is to develop in the brain, you just think proprioception is the master sense for regulating all other senses like vision and hearing. But proprioception is the first to develop. Even at conception, we have these primitive reflexes that are developing. So the brain isn't fully mature with a full mature motor cortex, but it has these primitive reflexes, which allows the child to make these reflexive movements. But I think movement is so crucial. I don't think we put enough emphasis on it in our modern day environments. And we're seeing more of the health conditions now that we used to see in older individuals, but we're now getting them in younger individuals. Not just the lack of movement itself, but along with that is also nutrition. Our foods are more processed and they're ultra processed now. And I think it's having a huge regression on the way our brains are developing. It's a huge threat to society, and I think people should really take note of what I'm saying here, because we can see it, and most of us are using certain reasons to try and explain why the brain isn't developing optimally, and we're almost normalizing pathologies as well. Just, like the CDC mentioned, about 50% of young children now don't crawl normally. So what they decided was, because a lot of them are number crunchers, they decided crawling wasn't important. But we know crawling is super important, and it's absolutely vital to develop a good, stable core postural system with the spine, integrating them both left and right, what we call horizontal integration in the brain, which we call the right and left. And that's how we crawl, to then prepare us to develop to the next stage of learning, to put us on our feet. And if you speak to anyone and you just say, well, look, crawling's not that important anymore, they've just decided it's no longer a milestone, most people sort of respond in a way where they're quite shocked. Well, what do you mean crawling isn't a milestone anymore? And that's because we're looking at this curve where children are coming in, they're not demonstrating correct crawling patterns, and then we're normalizing it. And then what's the easiest thing to do is to just remove it completely, which is going to cause a huge problem if that's not regarded as a milestone anymore. But I think also what's preventing children from exploring the floor and moving is our modern day environments. Screens, tech is huge.
If we don't intervene, so it's clear to see that our brains had a code, they had a sequence of how they developed 30, 40, over the last however long that humans have been around, and they've been set up to develop in a certain way. Over the last 30 years, that's changed. We're going to talk about in detail all the things that have changed, all the threats to brain development. What's going to happen if we don't understand that we have to think about the past and how the brain needs to develop? What's going to happen if we don't make these changes, if we don't understand?
I think we're already seeing what's happening. We're working in lots and lots of schools. Our 4-year-olds now that we're that are heading into reception at school are physically behind how 4-year-olds used to be 20 years ago. So we're now seeing it in schools, and head teachers and teachers that have been in profession for a long time are kind of just saying, well, our 4-year-olds don't seem ready for school anymore. Well, that's because they're physically not ready for school yet. So it's the physicality and the movement that prepares them for school. So going back to the milestones, Seb spoke about it, it's movement milestones are crucial. And our children are now not hitting those movement milestones. So if we don't hit our movement milestones, we'll then have a delay in academia, in social skills, in sensory systems, in postural systems and things like that. So it's super important. It's not a thing that we're going to see. We're seeing it. Children are now not ready for school at 4, on the whole. Not some children are, don't get me wrong, but as a generalization, children are behind how we were as 4-year-olds as a generation, for example. So it's happening. It's happening, and we cannot get away from it. And we cannot come up with ideas that it's always been there and we're now just identifying things better and we have more empathy of challenges and all that. No. Our children are now behind how we used to be. And movement is crucial.
And that's a hard thing to say. That's
Yeah.
a hard thing to say as a parent. That's a hard thing to say in society in general, because of course we accept differences. Of course we accept diversity. But if there's something you can do about it, we're all fathers.
Yeah.
We've all been there. If there's something you can do to help your child, to ease their pain, to ease their burdens, to ease their struggles, you're going to do it. And to do that, we need to understand the root cause of all of this. And what we're saying is environments are causing these issues.
Well, actually, every movement that a child makes, every movement is for a reason.
Yeah.
They're not just cute baby movements. So even our babbling children, that's not just, look at they're cute and they're babbling and blowing raspberries and blowing bubbles. No, that's movement patterns that are developing in readiness for the next phase of learning, whatever that is. So babbling around the mouth is preparing the baby for speech. So it's not just cute. Our babies rolling over and sitting up and crawling, they're not just, they just happen. No, they're fundamental milestones that we must hit. And we Seb and I talk about it all the time, that if you've got a child now that's a 9 months or 10-month-old baby that's not crawling or is crawling dysfunctionally, and you may go and take them to a health visitor or a pediatrician and things like that. We hear this quite a lot now. Oh, it's okay. All children develop at different stages. They'll be absolutely fine. No. There's a reason why we get an email from the NHS at 9 months saying your baby should be doing X, Y, and Z. Because there's a blueprint. We speak about it a lot. There's a blueprint, and it's not bang on 9 months they should be crawling, bang on 12 months, but it should be around that time. So if you've got a child that's not crawling at all at 9 months or dysfunctional at 9 months, well, we've then got to try and do some intervention there. And that's just understanding that left leg shouldn't be dragging. Okay, so what can we do? Well, we put the baby on the back, we fire that left leg, get some movement patterns going, which fires the opposite hemisphere of the brain to actually support that child. And we're now kind of, like Seb mentioned, we're just normalizing pathologies and challenges, going, it's just normal. It's not. We can help, which is super. And actually, us as parents, we want the best for our children, and we want diversity, and we want every child to be different and unique, which they will be. But we're seeing en masse now that children are not developing how they should be because we're simply not moving as much. And there's many reasons for that. It's not parents' fault. It's the tech industries and even something Seb and I talk about it quite often. Things like car seats. Of course we need car seats. They keep our children safe. Of course we do. However, that child doesn't need to stay in the car seat when they're not in the car anymore. because it straps them in and then stops them moving. Swaddling, yes, we want to swaddle and colour our children, but not for hours on end, because our children must move. So movement, for me, movement and nutrition are the two biggest threats that our children have now. And there's many other factors which we'll go into, but it's movement and nutrition. If we get those right, then we give our children a better chance of those foundational development milestones.
It's fascinating. And said there's loads of other secondary health conditions. Obviously, there's the first things you see with certain behaviors, certain learning difficulties, certain developmental issues with children and adults today. But what are certain, I mean, the brain controls everything, right? So there's a knock-on effect of other conditions, other health conditions that arise because we're missing milestones and we're not developing the brains as we should. And what are some of those that spring to mind that we're seeing more of in kids? I know kids are struggling with food allergies and tolerances. Digestion's a huge one. Explain a little bit about how that happens from a brain development point of view.
Well, some of the health conditions, Steve, we're seeing now kids who really struggle to balance, to coordinate. And you mentioned the digestion issues, but also they tend to have higher heart rates, which lead into high blood pressure. It's leading to fatty liver diseases, which only the older generation used to get because the foods now are pumped heavily with processed and chemicals, which are causing this fatty liver disease now amongst children. And what we're getting is we're getting postures now, forward head postures, which is causing a whole host of neck problems and back problems and knee problems now amongst children, which I remember as a child and all my friends, I don't remember them really struggling with any. And we used to play football and we used to play all the sports they're currently playing. But we're starting to see more of even the postural sort of pains that are and the aches that old people will tend, or people associate it to as when you get older. Oh, it's because I'm old. Well, now we're seeing this in children. And I also believe, I just think expectations from our children has been drastically lowered. Our expectations have drastically lowered amongst what we expect from our children as well. And I'm a father, and my children know I have a certain level of expectation. And I think that's important. And I've got to make sure I lead with it being high myself. I also believe we have to have a level of expectation from our children. Because if we don't, children now are being left or they're being overprotective. And I understand it from parents' point of view, but what's happening is we're not exposing them to these challenges. I find we're not challenging them enough. And we don't want to challenge them so we overwhelm them. I have seen there is a massive overprotection now over children. Expectations are a lot lower. We've got reasons of why they can't perform certain skill sets that they should be able to perform. So I think there's all these factors now that are playing into this lack of development in every part that the brain controls. And I think it's influenced in a way where if we just make people more aware that these are areas that we should be aware of and not accept it as these are just the typical, this is the typical development now. And we go, well, we can't accept that. Well, I certainly can't accept it because I know what the brain is capable of. Because for most part, most of these individuals we see, Steve, is that, there isn't any metabolic illnesses or diseases. There's no brain injuries, pathologies. And I always say there's no damage. There's no mutations. So there isn't any reason why these children can't access their full potential. Because I certainly would want that for my children.
And I think we see that a lot, even with going into schools and working with children a lot now, that some children can't do forward rolls anymore, or roly-polies, what we used to call them, and things like that, and forward rolls and backward rolls. They can't do that anymore, but they should be able to. And it's simply because, in my opinion, our children don't play as much. They're not outdoors as much because we're helicopter parenting a little bit and preventing them from trying to stop them hurting themselves all the time. But also, obviously, tech, they're sat down more sedentary watching tech and entertained. Whereas when we were younger, we didn't have children's programs all day, every day. So we had to go and play. And then you end up doing headstands and jumping off sofas and bouncing on sofas and all those kind of things. So the movement patterns that we used to naturally just do because there was something to do, our children don't have to do that anymore. So I think and we see, when you see a child that is really struggling to move, that's not just going to be a physical problem. That's a developmental problem which will we'll see in other elements, whether that's reading and writing or emotional regulation or whatever. So it's the movement bit is first.
Well, in science, Steve, there's a principle that says, simple movement, simple brains, complex movement, complex brains. And what they mean by that is you just look at the very early stages of what a child can actually demonstrate in movement. And it's very reflexes, very simple movements. And then as the brain starts maturing, the skills, the movements start maturing as well. So the more when I'm also teaching, a young athlete or anyone, the first thing I try and look at is try and improve their movements. So if there's a certain movement they can't do where they've never skipped, or they've never stuck a jump on one leg or single jumps, or even to the more advanced where you're teaching them handstands and then walking on, but that's real. But you see the coordination and the balance and the stability in what this body is capable of. But we stop accessing or challenging the body, but we don't see how this affects then cognition. And there's a massive relationship between our bodies and our brains. They're not separate. They do the same thing. It's controlled by the same systems.
I think it's important as a parent and sort of looking at your child and looking at their development. I think the key message here is you can improve their coordination. You can improve their balance. If your child is struggling today with those types of, it's something that you can improve by practice. But it's also knowing when to push, when not to push. We're told that we have to accept all of these differences and accept these things. But actually, if you see your child struggling, what does every parent want to do? You want to help your child in social situations. You want to help your child be more confident. You want to help your child with anxiety. You want to help your child be able to thrive in the classroom. Of course, if they can't do that, we love them just the way they are. We accept all those things, but it's actually understand it's not a terrible thing to want more for your child. And it's not about wanting more because it helps you out. It's wanting more because you can see them struggling. Like no one wants to see their child put on a sock 15 times and have a meltdown because the feel of the sock, the line on the sock is causing them issues. And that's not something that we have to leave them to cope with.
No, we don't. Can't
That's
just
something
accept
we
that.
can help them with. And when my child was going through it, my eldest, and I just looked at a life for her of, crikey, she doesn't feel comfortable in her own skin. She doesn't feel like she feels her own body. She struggles with empathy, which means that she's going to struggle with relationships. She struggles to understand how people should behave towards her, in terms of, what's an accepting behavior towards her. If a friend or if a child is being mean to her, I could tell that she didn't understand whether that was right or wrong. And all of these things where you think, how do I help my child? Because I can see they're sad and I can see that, that all of these things they're battling with. And when you start to see, well, actually through movement and exercise and understanding these things called primitive reflexes, we can actually make a big difference
huge.
to the way that they feel as an individual, their confidence levels. I think that's an unbelievable, empowering message. And it shouldn't be taken negatively as we want to change children because they're not good in the way they are. You want your child to have every opportunity possible open to them and not be limited by their skill set that they currently possess, which is, you're going to see they're going to struggle in certain aspects of life. And that's normal. That's what parents see all the time. But I think we have to unlock that stigma associated to trying to help kids with developmental issues. And we see that we've seen improvements. We've seen fantastic transformations where kids have been really struggling to where they're thriving and they're absolutely killing it. That's a good
If
thing.
you look at, yeah, absolutely. See, you look at most of the kids, well, no, all the kids, it isn't most, all the kids I've had in on the spectrum, let's say, whether it's autism or ADHD, every single one of them have demonstrated the retained reflexes, every single one of them. So that already proves that these individuals are still in a state where foundations haven't matured, which is going to be very difficult then for the brain to access these higher functions that we want them to access now at 10. But the 10-year-old brain is still at a 1-year-old retained reflex. So the priority of the brain is survival and to keep you alive. So we've got to make sure these reflexes have integrated in order for us to then allow that child to then access chronologically what a child should demonstrate developmentally as well at 10. but it's going to be very difficult for them. And every single child I've had in, I've all got retained reflexes. Not a single one where I've said, no, brilliant, no retained reflexes. I just can't understand what's going on. Every single one of them have just not integrated these reflexes, which therefore then it's very hard to inhibit certain behaviors if the foundations haven't integrated.
I think that's the really important bit, that we've got let's say a 10-year-old girl, for example, that's showing emotional irregulation and seems a little bit immature in her behaviors at 10. Well, what tends to happen in most common kind of medical professions now is we try and look at it as a top-down approach. So do they need psychological interventions? Do they need psychological support? How can we help with this? Well, what we need to do is go from a bottom-up approach. Okay, so does that 10-year-old who's having this challenge, have they integrated or switched off all these primitive reflexes? Well, if they haven't, we've got to go back there first. That's the really, really important thing. So, and then that gives that child the foundation and the basis in order to be that 10-year-old. But like Seb said, the brain is survival mode. That's what it cares about. So if we've got retained reflexes, the brain's still doing its job, and it's keeping that child in that part of the brain and that region of the brain in survival mode.
So what we're saying is, if a child can't regulate emotionally, that's not a permanent behavior.
No, that's not. That's just them. We love them how they are. No, actually.
Yeah, Steve. So that's important because we have an important reflex called the moral reflex, which is related to fear, the fear paralysis reflex. So the startle response, and you could demonstrate this amongst adults, a loud noise, how many of us might jump? But it's there to pre-warn us. That's what the reflex is there for. But then we inhibit it because we review it in our minds, whereas a lot of them are still in this reflexive state. There was a loud noise. And then the only option they really then have is they freeze, they flee, or they want to fight someone. And then they have these tantrums. And most of the people that want to fight is the people that's trying to calm them down because they've seen a threat. So that's the only system every single human being has been given. So that's why these reflexes have to be not only just integrated, but it's got to be able to inhibit as well that next behavior that's got to come. And that's what we've got to recognize, is they're there for a reason, and they can become undone at any point. And this is where the threat to our brain needs to be emphasized, because if we remain in these fearful states for too long without regulating or without being able to review it consciously, which you talk about the top down, is we're going to still remain and react, and we're going to become more reactive than responsive because we are in these reflexive states, these primitive states. And if we remain in that, then you just imagine how being in a state of fear constantly, Steve, how is that ever going to access the opposite to the sympathetic, the fight, flight, and freeze response, which is the growth and digestion, the parasympathetic that we talk about? Because that's what these reflexes are keeping us in survival mode. That's why in the beginning, the child's in sympathetic states. The immune system hasn't developed. The digestive system hasn't developed. It's not ready for solid foods. The teeth haven't developed. So everything has to develop in these stages.
Explain that sympathetic, because I don't think everyone would know sympathetic and parasympathetic, and a child being in that sympathetic state. So you're saying between the ages of 0 to 3 or 0 to 2, a child needs to be in a sympathetic state.
These important nuclei allow us to stay in sympathetic for the very first year of life. So right at conception, Steve, because and that's what these reflexes do. So you have the ATNR reflex, which as soon as you turn the head, the baby will do this in fluid. This is what I mean by milestones. So the ATNR reflex will take part as it's trying to make its way through the birth canal to position itself to the right. So that is the correct way of birth. And then the spinal gland reflex kicks in. So when you stroke a child's back or an adult's back, what happens is they react or respond to the right with a hip movement towards the stimulus. And what it does is it helps that baby shuffle through the birth canal, which then prepares it for the next reflex, the TLR, the tonic labyrinthine reflex. So the baby then is like a puppet. So it can't separate the head from the body. When the head goes down, the whole body bends, it flexes. And then what happens is when it comes into the world, the head pops out and then it extends and it pushes out using the tonic labyrinthine reflex. Well, if you've had a C-section, then we've missed the milestones. So this is when then it prepares for the next stage. So these are just milestones that are important to know if the child's in foundational phases are developing correctly. This is why the blueprint is so important. And then when it comes into the world, it then starts to activate the rooting reflex. It starts to latch on to the nipple for feeding. And then as 3 months go on, it then learns to roll over. The ATNR kicks back in, the TLR kicks back in, and then it starts to commando crawl, prepares for these stages, and then it sits up independently. So now we have these tonic labyrinthine, the vestibular reflex, the head tilting reflexes are now starting to develop. But these primitive reflexes all have a role. That's why the blueprint is so important. And then it gets on its hands and knees, and then it rocks forward and backward. The STNR now is kicking in, which is slowly starting to develop this amazing solid core foundation and this coordination to prepare for the ATNR again. And then it starts to crawl, and in the beginning it's same side crawling, and then it switches to opposite side crawling, and that's the correct way. And then that is what's aligning itself to build them strong movements and coordination between the right and left, what we talk about, the horizontal integration. But what happens is each reflex that is being developed is inhibiting the next reflex, so the child can move on to the next to help integrate that reflex, the next level of learning. And as it's doing that, it then stands up, and then it starts to pull. So we have the pull, and once it starts to cruise around furniture. But now the Babinski reflex is starting to integrate, to prepare it for walking. Because when you stroke the bottom of a child's foot, and all pediatric neurologists will test this anyway, but if you stroke the child's foot, you'll see that the toes fan out and they reflexively extend. Well, for us to walk, we need to be able to press down on the floor to push off the toe, the big toe, actually, to build the arch and to build, obviously, the system going up, the calves and the quads and everything else. So it needs to be able to press down. But if you keep fanning out and that Babinski response remains, we're then going to end up with balance problems, because it can't press down. And that's why the Babinski response is so important. And then if it's only on one foot, and it's not on the other, then we end up with this asymmetry with balance, which then leads to coordination. And this is why it's so important. And you tend to see it with the ones who drag the feet on one side. They stand up and Babinski's only active on one side, but then they end up with postural problems, asymmetrical postural problems. So you see this asymmetry with hip height and shoulder height, which then they later diagnose with scoliosis. But this is all stemming from the foundational stages of these milestones. That's why they're so important. In order for digestion to mature, to transport the nutrients, we need a strong digestion. Then muscles need to be able to contract. Well, if you've never really explored the floor, you don't really develop a good, strong digestion system. The intestines are not very strong. They're not able to push the food out. So these kids then end up with constipation. We tend to see then, now we know the gut-brain connection. But if we're talking it from a brain point of view, this is where they all reside. That's what controls all the functions in the autonomic system.
And I think that's
why these milestones are so important.
So important. And again, comes back to the threat from the environment. These reflexes are not switching off as they should do because our children are not moving as much. And they're not moving much because of tech and car seats and swaddling and not allowing our children to explore the floor and do what they should be doing. Now, of course, we want, with our youngsters, we have kisses and cuddles and passing around family members. Of course, absolutely. And they need that as well from a sensory point of view and eye contact and all that kind of stuff. But the threat that the environment's now causing is making these reflexes not switch off, because the only way the reflex will integrate and switch off is movement. There is no other way. But that's how it. So Seb just amazingly explained the process of these reflexes. Well, that blueprint is so important. It's so important,
Steve. And at 12 months, the Babinski response kicks in. But remember, it's building, it's integrating these reflexes, but it's inhibiting these reflexes at the same time to then eventually develop, to then try and integrate and inhibit the next movement, which then develops social skills. Because at 12 months, the child should now have good eye contact. It should be able to be pointing at 12, 13 months. It should be able to say 3 or 4 words. So these are little milestones that this motor cortex doesn't have the ability to do in the beginning, but it has to develop it in stages in order to then demonstrate speech. it's a motor cortex. So it's not that these children now we get that are nonverbal can't speak. It's because they can't access the motor units, the language units in the brain, because these reflexes are preventing access to it. And that's why it's important. So it's not that we can't, we can't help them speak. I've done that in schools. I've done it with individuals, parents who have cried and messaged me and says, "Oh my God, my kids have said, words for the first time and I couldn't believe it." And now they're stringing sentences. Now they have no problems with speech because the language networks are all there, but you can't access it if these reflexes haven't integrated.
So we talk about movement, we talk about milestones, we talk about reflex, and it all sort of blends into this development stages in the early years. It's not just as straightforward as that, is it? In terms of if a child moves really well at early stages and they hit their milestones, there's still other factors that we have to consider from a developmental point of view.
Absolutely.
We have to think about what the brain needs: nutrition, the brain needs sleep, the other influences. Like, how do you raise your child? How do you parent your child? All of this goes into
How are they breathing?
how a child.
I think, Steve, but the autonomic responses, the foundations is the primitive reflexes. They're the absolute foundation. So if you tend to get that right and you're intelligent enough to look for it as well and to be made aware of it, because as parents, we're never made aware of how important these milestones are. And this was the biggest problem with my eldest girl. So the goal first is become aware of this knowledge, because we are normalizing pathologies here. Because as a parent who's really active, loves exercising, loves sport, I thought my eldest child was really advanced because she was crawling at 9 months to then later get diagnosed and struggling academically. Although
Because she was
gross
walking.
motor,
She said, "You mean walking
but
at
she
9
missed
months?"
crawling.
Yeah,
Yes,
yeah.
she missed crawling phase,
Yeah, yeah.
but she walked at like nine
9
and a half
months, yeah.
months or 9 months. She was flying upstairs, and that's very, very early. That is not advanced whatsoever. But as a parent, I thought that was advanced because she's gone from one stage of sitting to straight away stood up. So I was like, "Oh my God, this is like amazing." But it wasn't amazing because later on, what
We've
we're
missed the
finding now,
milestone.
we've missed a crucial milestone.
Yeah.
So, and the good thing is, this isn't about, we don't want to create anxiety within parents as well, just because they miss milestones, that, your child's doomed forever and is going
No.
to struggle forever. They're not. It's just important. It's important that we recognize what milestones were missed. So we take the historical biography of that individual. And then what we do is we recognize what areas were missed, Steve. And even if they can't remember, we can also test for them. And then we put that information back in and we allow them to create these synaptic connections within the brain as well, so in order for it to allow to myelinate these regions that currently weren't accessed in the beginning.
And so a big part of intervening with, if a child is struggling with certain behaviors, learning difficulties, developmental challenges, say 8 years old, 9 years old, is to go back and plug this information in. And does that correct a lot of these behaviors immediately? Like, talk a little bit about how that process then changes the brain and the foundations are there, and then it allows the higher executive function.
Well, what happens, Steve, is in the tattoo is every child that we have who are struggling or have also had a diagnosis of autism, ADHD, you tend to find even adults, OCD, mental health, depression, anxiety. What they all demonstrate is they have retained primitive reflexes. Now, they're very unique to the individual. You can't just say that child is unable to sit still. He has the spinal gland reflex, but most commonly, that's what we sort of see with a large portion of the individuals who are more hyperactive. But also we see this TLR retained. So we can almost determine what could have been missed just based on the reflex profile, but after you've tested them. And also when they fill out the questionnaires, you can see it. So when you see these individuals who really lack this control or regulation of emotions or behaviors, we always tend to see that there are retained reflexes with a lot of them, and some of them also poor lifestyle habits. And that's really important to address, to recognize where the insufficiencies are in life. And some have been gone through some horrendous moments, traumatic experiences. So it's not unusual for them to have retained reflexes, and it's not unusual for them to then try and opt for a more instant gratification of this dopaminergic effect, because it's instant. It's trying to get them out of this pain, but they still have to then come back to what they never resolved, was this internal game. And this is where a lot of them are very disconnected from themselves. A lot of them don't feel themselves. They don't know, they can't map where they are. Their postural system is completely asymmetrical. You tend to see dysfunctions and head tilts on one side, more so to the right in individuals who are on the spectrum, and they tend to walk on their toes as well. And that's a vestibular, but also it's retained reflexes, and it's these poor lifestyle choices with nutrition, or they're on medication which are having side effects as well. And we've got to look at these combination effects with some of the medications as well, because it's just not agreeing with them on a long-term basis. So we look at all these factors, Steve, and some of them, are trying to run away from the pain through alcohol. So they intoxicate in the system because it's an overuse of alcohol. Some turn to drugs, and you're trying to realign their habits to understand how this affects the brain. And if these habits are affecting your brain now, if you continue down this path, this doesn't get better. This only then leads to a worse outcome. Once you tell them that simple truth, you've then got a place of then trying to communicate with them and helping them understand and change and reframing their perspectives about certain life, which is a top-down approach. But that's only very short term if reflexes don't integrate and these poor lifestyle habits don't change.
The disorder, the other health conditions, the autoimmune issues, the digestive issues that stem from the way the brain's developed and way that the brain might not be functioning as it should. Describe a little bit how an autoimmune disease or disorder manifests, and how we can go back to improving some of these missed milestones or some factors in primitive reflexes, and getting these children back to a sort of parasympathetic state or whatever. How do we treat these extra conditions? Because I don't think a lot of people realize that comes down to unhealthy brain development as well.
Yeah, absolutely, Steve. So, there are in the beginning, we are born in a sympathetic state. So you have specific nuclei in the brain, and that encourages maturity first with these reflexes, and that regulates breathing and heart rate. So it's important, like if the moral reflex remains, that heart rate's gonna remain high, and it's gonna map out to the brain, and it's gonna align with the brain as if that child's in constant threat. Now, if you're in constant threat, that child can't ever access parasympathetic because its main priority is the threat. I've got to resolve this threat. But if it remains in an autonomic response for too long, Steve, this is why stress is amongst one of the biggest killers amongst adults. So, but that's because these individuals are in sympathetic states, autonomic states, and then they're using even more stressful habits, let's say, these lifestyle habits, to try and calm the nervous system down, but it still remains in stress. And then that's when the immune system is overburdened. It's very much like some of us, and then these genetic predispositions, Steve, where some of us have been given very small cups and we're quite at a disadvantage, and some are given large cups. But if you keep filling it with these poor lifestyle habits, lack of integration and inhibition of these reflexes, then the cup overspills, and then that's when the immune system is just overburdened and it almost turns on itself. And if you're in stress, the digestion system switches off because the immune system is active. So there's this amazing communication and synchronicity between the two. It's the opposites. So this is why you can't access good, healthy digestion. And you tend to see that with the way when a child is dehydrated. Just look at the color of the urine, and that will tell you how dehydrated they are. But you also look at the poop, and you can see that it's unhealthy. So then we've got to address it from the point of, is it, primitive reflexes? Is it core strength? Is it nutrition? Is it a combination of both? Are there some predispositions that we're unaware of? We might be sensitive to certain foods, certain stimuluses, and we've got to be made aware of that to try and bring the body back and to then develop the other nuclei in the brain that then responsible, which really switch on at around, I would say about 12 to 16 months, Steve, is when the parasympathetic then starts to come into play. Because what's then happening is the solid foods are starting to kick in because the teeth are developing. So everything is in sympathetic. They're teething. Everything is growing. They're more susceptible to viruses and they get ill more often. But the body's trying to recover. And this is where the sympathetic is in action, because the immune system is just constant in stimulation. But we've got to try and bring it back down. And that's what the sleep does. That's why babies predominantly sleep, because that's one way of the parasympathetic, the body healing. And then the nuclei matures, Steve, but the nuclei is only mature if these reflexes integrate and mature to then allow the brain to then sequentially mature. And that's what then matures this great synchronicity as well between the sympathetic and parasympathetic.
Amazing. So if children aren't inhibiting some of these reflexes, they aren't getting out of this sympathetic state, this is where a lot of these issues are going to come from.
Yeah, which then leads, Steve, a mouth breathing, shallow breathing. You tend to see individuals in sympathetic states. So then later on, they could get diagnosed with stuff like fatigue syndrome. And it's not that they're fatigued. It's just these individuals now, teenagers, even young adults, is they've constantly shallow. So they've been in this sympathetic state for so long. And if you're in constant states of stress, Steve, you're not really going to have much motivation to do much in life because there's a lot of stress on the system. And if its whole priority is to keep you alive and to keep balance, then it's going to send you to sleep because it needs to recover from all the stress, although you've not really been active physically at all. And this is what we're now getting. We're getting overwhelmed individuals with so much fear. We just got to watch the media now. A lot of them are in front of screens with this hyper attention, constant dopamine rewards, creating more stress in the system. And that's the different types with, when you speak to someone who has ADHD, let's say, and one of the first common questions I would ask him is, what type of ADHD do you have? And they're like, what? I was like, what type do you have? And they honestly can't answer. So they've been told they just have ADHD. I'm like, but it's important you know what type you are, because that will determine which hemisphere, but also which reflexes have remained retained, but also which hemisphere is more dominant. So the inattentive type, you tend to see that's type 1. And then you have type 2, type 3, which then you go the impulsive and inattentive, or you have the impulsive, inattentive, and hyperactive. Well, which type are you? And the most extraordinary thing is the inattentive type, although they've been diagnosed with ADHD, are the complete opposite hemispheric dominance to the impulsive, hyperactive, and inattentive. So we're treating the same disorder with the same pill, let's say. But it's two different hemispheres that control the immune system differently as well. One's stimulating and one's inhibiting. Digestion is different as well. So the way we then digest foods and our food sensitives are completely different from which one's more dominant. But most people won't know that about ADHD. They just go, yes, I've got ADHD. But which type are you? And they honestly have no clue. It's astonishing. So this is where we then do
do they have no clue
unique
because
profiling.
Their health professional hasn't ever taught them this, hasn't ever explained it in that way?
Absolutely, yeah, absolutely. That's where it stems from. It's just, okay, we're doing a polythetic assessment. Me and you have got 1 out of 10 symptoms the same. Because you've got the first 1 out of 10, 1 out of 20, let's say, and you only demonstrate that you've got 1 out of 10. At 10, the first 1 out of 10 is your full profile, but mine is the 10 out of 20. So we've got one. The 10th symptom is we only have one the same. But basically, all that means is you're just very dominant in a certain set of behaviors, but them set of behaviors are unique to that hemisphere. And that is why we then get these individuals who some respond really well to the drug and some really have a hard time with it.
So what type of ADHD would respond well to the drug?
So it will depend again what type of drug they give them, because there's so many now.
Yeah.
But it will depend on the predispositions as well. But if you look at the inattentive type, Steve, they need the stimulation a little bit more. So, they've got that right hemisphere that's in more growth. But you can see that also with the way they run with individuals, or one side is always stronger than the other. And Steve, you've demonstrated this when you've put someone on a side plank and you've gone, oh my God, they're much stronger on one. Or you could do it where you get them to balance on one leg and they can balance so much better on one side than the other. Well, that demonstrates that side of the hemisphere is much more dominant. But also if they lack the ability to, regulate. So if they have hyperactiveness, well, that's a left hemispheric dominance, and inattentiveness is more of a right hemispheric dominance. But if they've got inattentiveness, but you see, attention has been studied for like years. It's one of the most common sort of research in psychology at the minute. So in the mental health world, attention is one of the top. So there's only like 5 different levels of attention. So you've got sustained, you've got hyper, you've got, divided attention. So the way we do it, Steve, is we would, if it's more the inattention, and then people go, yeah, but you've got the ability to play video games all day. Yeah, but that's because they only have the hyper attention, which is the left hemisphere. Only 1 out of the 5 in attention resides in the left hemisphere. The rest are all right hemispherically deficient. Yeah. So you go, well, okay, if that is, you have the skills to be hyper focused and hyper attentive, then of course you're going to get on with games because it requires a hyper focus and a hyper attention. But if you're lacking sustain to be out in the wild and you're waiting to get that, say, or you're in a classroom, let's say, which is sustained attention, it doesn't need hyper attention. So this is where we've got to be able to understand ADHD. Within that, there's then even subtypes, because then a lot of them then end up with, say, stims or tics. But which part of the body is now stimming and which part is ticking? Is it the mouth? Is it vocal? Is it just the hands? So then we go into subtypes within that, which will determine which type of regions we've got to then affect and how we're going to affect them.
And you're breaking it down. Well, when you're breaking it down in so much detail, all that I'm thinking is, how does a drug help all of these fine,
the drug can't.
Issues?
The drug will only. Steve, do you know what? The drug is it's proven to be effective for about 14 months but that's for the most distressed individuals where parents are really, really struggling with this child because it just genuinely can't regulate. Well, if a child is inattentive, hyperactive and impulsive, that child's brain is having a hard time to regulate itself. But it's not that it doesn't have the ability, and the drug doesn't really create any neuroplasticity in the brain. So this is why we have to look at the foundational stages, because honestly, every single one of them has retained. But then what you would do is I use a lot of the monotone stuff. So we go, but I also want you to be able to divide attention, and then we put both of that in. But if they can't do it at the same time, then we work with sustained attention. And then we work with sustained and divided attention. And we put that in. And then hyper focus then develops on top of that.
And what specific therapy is that? You said the monitor.
So we use like the monitor, where it's the beats.
Beep.
Yeah.
And then we,
beep.
so
beep.
we can get them to clap to the beat to have sustained attention. And then what we could then do is we could then get them to touch a different color, which is then divided attention to the beat, but they can only do it to the beat. So that's how we would then put that into the brain.
And what's that doing? That's giving them those skills,
developing them skills. Yeah, because them regions are slightly underdeveloped. That's all that means. They're just slightly underdeveloped. And then we would look at also the TLR. We'd look at vestibular functioning as well, because you would look at the head tilts because they're more dominant on one side, which controls postural position and head position. So it tells us muscle tone on one side. One side of the face might be more tone on one side than the other. So, there might be more muscle tone down the back, the spine. So there's all these factors that are not really addressed in mainstream sort of assessments.
And I think that's really important then. Once you do have that asymmetry and muscle tone in the body, well, years down the line, you'll end up with lower back pain and knee pain and things like that. And then we start treating that individually. But actually, that's been developing for 10 years, 15 years, 20 years, because we haven't the foundations there. So, and then we go, I keep got lower back pain. Okay, well, is that retained reflexes. That's what's causing it. So we have it in the sporty world. If you have an impact or a contact, well, that's what's caused it. But if there's ongoing long-term lower back pain, hamstring problem on one side only, well, that's a neurological thing as opposed to an impact. So we have to then go back a few steps. And that's where the bottom-up approach is super important, that we have to, these reflexes, like Seb mentioned earlier on, they're the foundation of everything. And if we missed any of those, and what we're now seeing in our schools with our 4-year-olds going back to the threat, is that lots of these reflexes are hanging around. And when they hang around for too long, we then get lots of different symptoms and behaviors. And ultimately, it'll end up with autoimmune and digestive problems and postural problems, lower back problems, all those kind of things. They're going to happen. Seb, 10 years ago, whatever it was, I think we saw someone walking and a child walking, and Seb's, we can predict what's going to happen in 10 years' time because you can see it through movement. So that's where again, going back to the movement and the threats that we're talking about this pod, there are threats to our children's brains that are happening. It doesn't mean it's fixed, but we've got to talk about it and not just accept. We've spoken about this so many times, Steve, where we're going, I'm not just accepting my child's going down that route because there's no brain damage. There's no pathologies. There's no gene mutations. There's none of that. My child's super active, super hyper. That's just him. Well, no, we want him to be hyperactive when he needs to be, but he also should be able to sit down still, have concentration, have focus when he needs it. You can have both sets of skills. And that's really, really important that we don't just accept that's going to happen. That's just my son and he's like that, or that's just my daughter. She's always been anxious. Okay, why? Why is she anxious?